What are stretch marks? A stretch mark is a type of scar that develops when our skin stretches or shrinks quickly. Stretch marks, while otherwise being harmless, are frequent cause of cosmetic concern or disfigurement leading to distress in the affected individuals, especially females. Where are stretch marks commonly found? They can be found in many areas of the body but typically appear in areas with more body fat. Areas of the body where stretch marks commonly appear include the abdomen, breasts, arms, hips, back, thighs, and buttocks. What the phases of stretch marks? There are two phases of stretch marks. 1. Inflammatory phase. Red stretch marks. These last from a few months to 1 to 2 years. In this phase the striae take on a color ranging from pink to purplish red, and for this reason they are named striae rubeae. Early lesions of stretch marks are smooth, raised, irritable, and that can be red, purple, pink, reddish-brown or dark brown, depending on skin color. Early stretch marks may feel slightly raised and can be itchy. Scarring phase. The second phase is characterized by the disappearance of the erythema, which gives way to a whitish-pearly complexion, hence the name striae albae. As the lesion ages, it flattens, becomes pale and irregular with finely wrinkled surface which is usually permanent. If you run your finger over a mature stretch mark, you often feel a slight depression. Lesions. What causes stretch marks? If we take a closer look at the structure of the skin, it is made up of 3 layers: the epidermis, dermis, and the hypodermis. Primary pathology lays in altered dermal connective tissue framework involving components of extracellular matrix, ECM, namely fibrillin, elastin, fibronectin, and collagen. These structures provide skin resistance to tension and elasticity. There is a hypothesis reporting that stretch marks result from the inflammatory reaction that determines the initial destruction of elastin and collagen fibers. The pathogenesis of stretch mark is unclear, but the prevailing view is that it is related to changes in the extracellular matrix. What is the factors associated with stretch marks? Stretch mark generally developed in various physiological states such as pregnancy, rapid growth, common in puberty, rapid change in proportion of specific body regions such as in weight lifters, obese or weight loss. Pathological states such as Cushing's syndrome, Marfan syndrome. Stretch marks in Cushing's syndrome due to hypercortisolism are often wide and purple, which contrasts with the narrow and pale or pink striae of rapid weight gain. Marfan syndrome is a genetic disorder that changes the proteins that help make healthy connective tissue. People with Marfan syndrome are prone to develop stretch marks, often at an early age and without weight change. Medications. Stretch marks sometimes may occur as a side effect related to drugs such as local or systemic corticosteroid therapy. Increased steroid levels cause decreased production of collagen by fibroblasts, resulting in less elastic fibers in the matrix of the dermis. Other factors like genetic predisposition, fluctuating hormone levels, especially corticosteroids hormone. Gender, as females are more prone to developing stretch marks. How are stretch marks treated? Like any scar, stretch marks are permanent, but treatment may make them less noticeable. Treatment can also help alleviate the itch. In general, treating stretch marks is difficult. Treatment improves the appearance of stretch marks, but they may not go away completely. Addressing your stretch marks when they first appear yields the best results. Older, deep stretch marks may be more challenging to treat. Most common treatments for stretch marks. 1. Topical creams, such as hyaluronic acid. In 2 large studies, applying hyaluronic acid to early stretch marks made the stretch marks less noticeable. Tretinoin. Tretinoin is a retinoid, which may also make early stretch marks less noticeable. Retinol, another type of retinoid, may also help fade early stretch marks. Glycolic acid. Glycolic acid may help reduce the appearance of newer stretch marks. Laser treatments. Microdermabrasion. Microdermabrasion breaks up the top layer of skin and helps tighten collagen and elastin fibers in the skin. It does not guarantee results but may help. Chemical peel. And others procedures that dermatologists perform. It's important to understand that no single treatment works for everyone, and many products don't seem to work at all. If you're pregnant or breastfeeding, check with your doctor before treating stretch marks. Some products contain ingredients, such as retinol, that can harm your baby. Home remedies. In studies, popular home remedies have not worked. Researchers found that none of the stretch marks faded when people massaged almond oil, cocoa butter, olive oil, or vitamin E into their stretch marks. You can't do anything that guarantees that you won't develop stretch marks, but a combination of hydration, diet, and exercise can help reduce your risk.